Hello, everyone. It's nice to be back. I did retire a little over a year ago, and I've been working on this project since then. The patients finished the trial, their participation in the trial, and it's taken all this time to put the data together, to clean it, and to analyze it. And so we finally have some good data to show you. I wanted to tell you that I have no disclosures, no conflicts of interest, and neither do any of the other authors. And but we do want to thank the funders of this study, and that includes the Colorado Department of Public Health and Environment, the Michael J. Fox Foundation, and also the Paul V. Fegley and Jan Marie Fegley Crawford Endowed Fund in Neurology. And I think Jan Marie's on here with us remotely, so thank you for your support. This, I wanted to follow up one thing on the previous talk by Dr. Hefferman, clinical trials. When I was here, then I did tons of clinical trials, and there's pluses and minuses to participating. But I think the bottom line is you participate in a clinical trial out of the goodness of your heart. Because if you think that if you only participate because you think that you'll get some benefit from it, then you'll probably be disappointed. But a good reason to participate too is because you get to meet on a regular basis, spend a lot of time with the experts that are on the cutting edge of Parkinson's. So I have done a lot of research and encourage you to participate. This research that I'm going to present to you involved a large team of experts in lots of different areas. And I wanted to highlight a few people, and that is Dr. Ying Liu, who really was instrumental and critical in getting the research done. And Dr. Stephen Seal, a statistician, and Dr. Jackie Bainbridge, our PharmD that managed the study products. So I'm going to actually tell you about 4 different studies that we did, but I'll start with just discussing cannabis use in the United States and in Parkinson's disease specifically, and why we are lacking in our knowledge of cannabis because the research is not there, and also tell you about the research that is there, and then finish up with some conclusions, cautions, and recommendations. So cannabis is being increasingly available in the United States and around the world. And the green states here are the ones that are recreationally legal, but the blue ones are the ones where medical marijuana is available. And the gray ones are where it's still illegal. So it's still illegal on a federal point of view. So its legality is a little bit controversial. Colorado, we can claim that we were the very first state in 2012 to allow to make cannabis use recreationally legal. There are more and more states all the time. I hope this is up to date. Every 6 months, there's another state approving it. So more and more people are using it. So they're in all the different states, then there's qualifying conditions. And this is a summary of the most common conditions for which it's been approved. Parkinson's disease is not specifically approved in Colorado. It is in some other states for cannabis use. But if you wanted to take cannabis on a medical marijuana basis, you would ask your physician to fill out a form, and they wouldn't put down Parkinson's. They put down insomnia or difficulty with pain or depression, anxiety, some of the other things that are approved. And some reputable institutions, the American Academy of Neurology, the National Academy of Science, and the Colorado Department of Public Health and Environment have summarized what cannabis the evidence for the use of cannabis in general for medical conditions. And so there is conclusive and substantial evidence that it is helpful in nausea and vomiting and chronic pain and some other conditions. In terms of Parkinson's, there's moderate evidence that it is helpful. And they have specifically looked at levodopa-induced dyskinesia, and the evidence, at least at this point, is not there. So why might we consider using cannabis in Parkinson's? Well, Parkinson's, as you know, there's lots of treatments, and there's more and more available good treatments all the time, but it doesn't completely alleviate the symptoms. And so a lot of people will turn to what they feel might be more natural alternatives, and that would include cannabis, and with the hope that maybe it would help in some of these symptoms that are listed here. Cannabis is made of
I want to talk for a moment
is made of a lot of different chemicals and components, and THC is the one that most people are familiar with because that's the one that gets you high. Then CBD or cannabidiol, that is the more soothing component, and so most of the products that you'll go out and get these days are either rich in THC or richer in CBD. So what is it? What might happen if you have Parkinson's and you took cannabis? Well, if it's a high THC product, then you might get a high, and nothing is wrong with feeling a bit euphoric. But THC is also known to make people confused acutely, and also can increase anxiety, can cause hallucinations and paranoia, and can decrease balance. So none of those would be good for our purposes. And then CBD might help with anxiety, might help with psychosis, might help with sleep, might help with some other things. At least it doesn't seem at first glance to have a negative consequences. So to get a little bit more specific about what the cannabis products are, then we would group them into four main areas: high CBD and low THC. And in that case, you would get that from a dispensary. Anything that has THC in it, you would need to get from a dispensary. And the purpose of that product is so that you would mostly feel the effects of the CBD. And the CBD sort of fights against the high, so you would expect to not get high. A high THC with low CBD product would, again, because it's got THC, have to be gotten from the dispensary, and you would get high. A product that has similar amounts of THC and CBD is supposed to give you mild effects of both, and you might get a high, but less so. And again, you'd get that from the dispensary. And then hemp. Hemp is a product that is basically CBD. And that always has, by definition, is supposed to have less than 0.3% THC, which is, of course, a tiny amount. So it's mostly a CBD product. And so therefore, it's sold outside of dispensaries. You can get it really almost anywhere. You can get it at your gym as you're checking, going in and out. You can get it at the grocery store, or you can get it at the drugstore, really just about anywhere. So I wanted to point out that you can get CBD and THC in all these different ways. And but notice the chocolate there. So everybody likes chocolate, probably. So you take a piece of chocolate. This one piece of chocolate is supposed to not have more than 10 milligrams of THC in it. So if you take oral THC, you don't want to take more than 10 milligrams. In general, that's felt like that'll get you high. And so you don't want to think, well, this hasn't kicked in, it hasn't done anything. And so after about 10 or 15 minutes, you take another piece. After all, it tastes good, and it still hasn't kicked in. And maybe 30 minutes later, you're getting a little bit like, my appetite is up there and that chocolate sure tastes good. So you take 3 or 4 pieces and then it hits you 40 milligrams all at once. So you have to be careful with these products. And in Colorado, the state law now is that every piece has to be individually, every 10 milligrams has to be individually pieced out and designated. And like one candy bar or one cookie can't be more than 100 milligrams of THC, which of course, if you ate that whole cookie, you'd be in a bit of trouble. So that's just reiterating that. There's a lot of different ways to take it. You can smoke it. We don't recommend that. Eat, drink, vape. Probably not the greatest. Dabbing or topically. Now, what is dabbing? So dabbing is where you have hash oil. It's where you have an extract that's very high concentrated in THC. If you remember back to college days, then you might have smoked a reefer, and it may have had like 5% THC. This dabbing extract has 60 to 80%. And so you can get a real strong high all at once by doing it this way. And that might be, I don't think it's even good for a 20-year-old, but it's probably not so good for people our age. So how would you get cannabis? If you wanted to get it, I think a lot of people have taken hemp, which is the CBD. So you can at the drugstore, you can go buy a bottle that's like has 10 milligrams of CBD in it and drink that down, and maybe you'll feel something. Maybe you'll feel a little relaxed. Or if you want something with THC in it, then you have to go to the dispensary. And so there's recreational and medical. And so you can just try your luck and go and get some recreational cannabis at the dispensary. The bud tender there will be happy to tell you all about the products that might be good for whatever ails you. But if you instead want to do the medical marijuana route, then you would talk to your provider and they would fill out a form and they would put down what you're needing it for. And they, however, don't know about what dose, or what kind. So they would just fill out this form and then you take it. And at the dispensary, they might have a different section that has the medical marijuana part, and they might have better products. And they will give you lots of advice on which products. But again, they don't have medical background or training. One reason is that the tax is high on marijuana. So a lot of people will go just to save the money. You don't have to pay as much tax if you have this form from your provider. Insurance does not cover any marijuana products. So we still don't know, though. We need to do this research. What's it good for? How much? What route is best? I just put this up here because this is a pretty good product. It's by Charlotte's Web, and this is similar to the product that we used in our study, but we couldn't use anything locally. We had to get it from specific sources. This is a cannabis oil, so it's CBD specifically, and servings that last you 2 months would cost about $120. So basically, cannabis is an illegal drug considered federally as Schedule I. And that means that it has no currently accepted medical use and has a high potential for abuse. And other examples of Schedule I drugs are heroin, LSD, marijuana, methamphetamine. So that's why it's very restricted to do research because the federal government views it as this. Of course, when you do clinical research, you need a drug that's consistent from batch to batch. So you can't go down to the local dispensary and buy some nice product that they might have, even if it's very well tested. We're not allowed to do that. So you can get it if there's a cannabis drug that is being FDA regulated in a study, you could see if you could get that product to study, or you have to get it from the National Institutes of Drug Abuse. They have a farm and they grow cannabis, but they don't have very good selection of products to use. So it's very hard. And then anything that has to do with cannabis is under intense regulation, and it's hard to get people to participate because they're not allowed to drive. This is an alphabet soup that this is regulatory agencies that you have to work through and maintain the paperwork for throughout. So it's a lot of work.
So
we accomplished 4 studies here at the University of Colorado, and I'm going to go through those. The first is a survey. The second is an open label study, meaning there was no placebo. And for that one, we were trying to figure out what dose we would use for the next study, which was a randomized controlled study, so with the placebo. And then the last one was a specific effort to look at whether CBD helps inflammation. There's been some thoughts that it does. And of course, a lot of evidence that inflammation plays a role in Parkinson's disease. So our first study was this survey, and the Michael J. Fox Foundation has Fox Insight platform. I hope that y'all are involved in that. It's got about 50,000 people on it that do and don't have Parkinson's, and you fill out information about your health and your Parkinson's if you have it. So we, with the help of the Michael J. Fox Foundation, had an invitation sent to all the people on the platform, inviting them to participate in this survey if they had or were using now cannabis in any form. And the survey included about 15 questions. It took about 15 minutes. And we did it in 2020. And almost 2,000 people completed the survey. They were on average about 65 years old. And they were mostly in the early middle stage Parkinson's, mostly retired, and mostly quite well educated. So I had mentioned before about 4 different categories to sort of put cannabis in. And so we grouped the respondents in either high CBD group or high THC group, or that they didn't know. And so the high CBD group was those that were taking the high CBD and low THC products, and the folks that were taking similar, and folks that were on hemp. And then the THC was a smaller group. So this part right here just shows that same information, but we found that people with Parkinson's were generally not, about 40% were using smoking and vaping, and 60% were using other. We also found that people were taking it as food, drinking it, oil, and a sublingual tincture, or putting it on their skin. And we found that mostly they were using it once a day, or 2 to 3 times a day, or just a few times a week. And that most of them had taken it less than 6 months, in a lot of them even less than 1 month. So we asked on this survey whether people felt that for a specific symptom, whether they felt like the cannabis that they took made it better or worse. Markedly worse, mildly worse, no effect, mildly or markedly better. And so this is a complicated slide. So what I was just talking about with them, markedly worse, mildly worse, no change, mildly better or markedly better on here. So just take this one row. This one row is one symptom, and this one row is my cursor isn't showing up there, but the top right is tremor. And you can see that a lot of that bar is yellow. So that means that a lot of the people, about 40%, didn't have any effect on their tremor with their cannabis product. But about 40% did have an effect, and a small, like less than 5%, had a negative effect. So if you look at the whole thing, you can see there's a lot of yellow. So a lot of people didn't have much effect on their symptoms from the cannabis product. And I figure that's why they probably didn't take it that long. But the symptoms that were helped are by 40 to 50% of people was sleep, agitation, anxiety, depression, and pain, and tremor, rigidity, dystonia, and cramps. And then the symptoms that seemed to get worse from their cannabis product, whatever it was that they were taking, was balance, and that's a bad thing, and that they had increased appetite and weight gain, and they had worse cognition and fatigue and excessive daytime sleepiness and dry mouth. But you can see there's a lot of yellow. So a lot of people reported they just didn't see much. Then so this again is a complicated slide, but the bottom line is that that people that were taking the high THC products more frequently reported an effect than the people that were taking high CBD products. So the THC seemed to have perhaps a more potent effect. And this was true for all the different symptoms that we tested for, that we asked about. So the red, the top line is, you can't read, is dry mouth. So a lot of people reported they had dry mouth much more frequently than in the CBD group. And then they also reported they had dizziness and cognition problems and balance problems, same pretty much as the last slide. And then the people that were, again, higher THC, they had benefit for depression, nausea, tremor, pain, agitation, anxiety. So this was a survey, and survey has limitations, but we wanted to kind of get a feel for what was going on in the Parkinson's community. We did find that almost 70% of people taking cannabis products did not tell their doctor, did not tell their provider. So I encourage you, this is to tell your provider. This is a pharmacologic medication. It interacts with other drugs, and it's important to let people know. So we did an open label study, and I'm just going to give you the highlights. This was a Epidiolex, which is a high CBD product, and we started them at a low dose and increased them to a very high dose, very high, up to 1,600 milligrams a day. And we did that because 1,600 milligrams a day was the dose that was shown to be effective, the only dose that was shown to be effective for sure in any condition. That condition was epilepsy, but we wanted to make sure and not miss out on it. So we did this range. 10 patients were able to complete that out of 13, and they had some side effects. But one side effect of concern was hepatitis in one person. And there were liver enzyme changes in about a third of folks. So this high CBD did not seem to be good in this older age group. But it suggested there might be some effects in some motor symptoms, sleep, and emotional control. So we went on to do a randomized controlled study. And this is just to point out that the patients were on a low dose first, and then they increased it. And they were on the study product for just a little over a couple weeks total. And there was half of them got the study drug and half of them got placebo. And we tested for just about everything that you could test for. We even did polysomnograms. And what we ended up finding is that the patients, this drug was from the National Institutes of Drug Abuse, and the patients ended up taking almost 200 milligrams of CBD in a day. So if you were to go to the dispensary, you'd probably be walking out with something that was about at max 100 milligrams a day, but probably more likely 50 or so or less. So this was a little bit high on the CBD dose, and the THC was 3 milligrams twice a day. So you could maybe feel a high from that, but probably not. So these patients were half and half. 30 took the study drug, 30 took placebo. There was no benefit. We have looked at this data inside out, upside down, and there was no benefit, and there was a very strong placebo effect. And so, in fact, the placebo group did a lot better than the CBD group. They both had placebo. I mean, the placebo people had a strong effect. So they had real definite improvement in sleep, cognition, and activities of daily living compared to the CBD group. And we think maybe that's because the CBD group did worse, perhaps, but they were still really hopeful. So this is what we found. There were some side effects, but none of them were serious, and the liver was okay. The literature has now, there's 8 randomized controlled trials, all done outside the US, except for this one, because it's so difficult here. But all of them used a different type of cannabis. And so you can only deduce from the trial, make conclusions according to that specific product. There were no benefits in motor signs in these studies, except one had found some reduced tremor, and there were conflicting results on dyskinesia. Some seem to improve anxiety, sleep, and quality of life. And then we also did a study on inflammation, where we drew the blood and looked at inflammatory markers in the blood, but the CBD didn't make a difference. Maybe that's because the patients were only on it for 2 weeks. So we feel like that needs to be studied further. But we did also, on an outside of this study, also draw blood from good, healthy controls. And it looked like that, that inflammation in Parkinson's is increased in all of these in many of these markers compared to healthy controls. And maybe CBD could have our researcher thinks that maybe it reduces alpha-synuclein, and so is going to do some further studies on that. So cautions and recommendations: don't mix cannabis if you're taking it with other sedatives or sleep meds. Please tell your doctor about it, and they can recommend to you what you should or shouldn't do. Remember, CBD, major side effects are to feel dizzy and drowsy. And by the way, it increases glaucoma. CBD has a unique propensity to pull toxins out of the earth. So the CBD products often, when they're actually tested, to have more toxins, heavy metals, for example, in them. THC causes significant side effects, including increasing the heart rate. And our polysomnograms did not suggest that it helped sleep quality, although it may help you sleep and you feel like it's helping you sleep. It's not actually improving the sleep structure. Don't smoke or dab. Be careful with edibles. This is an edible. You can spend a lot of money on this stuff. Go slow, carefully. The high THC products, they might be more effective, but riskier too. Give a product at least a month. Remember, there's a placebo effect that is strong and can last for 2 to 3 months. And don't drive on it. So these are some good sources of information on cannabis, and hopefully we'll have more research accomplished in the future.